can't pay, won't pay is not an option that is acceptable to anyone, but we must meet each other midway, understanding the dynamics of a business, what you need to do to survive as well, but also balance that with the needs of Kenyans, the various people that are facing these challenges.
Insurances do have some money, extra monies, and isn't this the time, such a time, when maybe you can now give back to your clients, especially those lower income ones who have no any other way to pay?
We have got reforms coming up at NHIF. It is the only way that we can be able to give UHC. And what we are going to do is we are going to work with Parliament so that Parliament can give additional funding for NHIF so that we can cover even COVID cases. Thank you. Thank you very much.
We will be talking about that, the cost of COVID-19 treatment. But before we went to break, Dr. Chibanzi Mwachonda is still on the line, and Senator Sylvia Kasanga, and now we're being joined by Senator Moses Kajwang. But Dr. Mwachonda, you said that if you catch COVID-19 and you're required to be admitted at an ICU facility, there's a 90% chance that you'll not make it alive. And when you say this, is it based on the damage the disease has already had on the patient, or is it about the care that people are receiving? And how can we turn this so that we have more positive outcomes out of such?
I said up to 90% being the maximum. But let me also say this. It's not about the care, because when it comes to care, the personnel are there in most ICU centers that we have that are fully functional. Forget about those that are cosmetic in some of the counties. So where there is personnel, they do and they dedicate their time. But there's also the cost of treatment that is becoming difficult. The drugs that we are seeing being given in the ICUs for COVID patients, the antiviral remdesivir, and then we need drugs that are called monoclonal antibodies at least to try and help. Those drugs are very expensive. A dose can cost as much as 300,000. And those ones have, to some extent, been shown to benefit to these patients. And then the third thing is that, I'll try and explain this because you really asked and you look interested in this, is that COVID-19, the virus SARS-CoV-2, obliterates your lung. So if your lung is supposed to expand and contract, it reduces your space of you to expand and contract as the damage continues in your lungs. So essentially, when you're in ICU, you're on a ventilator that is supposed to help you breathe. So it is pumping in air in and out of your. But if your lungs are not able to expand and contract because they're already destroyed by the basically you're pumping air into a hardened lung that can no longer expand and contract. And as a result of that, there's no circulation to your system, and that is why you're seeing most of them succumb to the disease.
Okay. All right. So I asked you a question. How can you reverse this? Is it, what can you do once you get the virus to avoid such an outcome?
There's nothing you can do as an individual, Sam, once you get the virus. The thing that you can do is, as an individual, to protect yourself not to get the virus. Because once you get the virus, you have no control of how your immune system and how your body is going to react to it. How you will, if you're going to go into severe disease, you have no control. And I've suffered this disease myself, and that was one of my biggest fear, being a doctor. That at some point, when I experienced difficulty in breathing and looking at my CT scans of the chest, I was not even sure how much damage is in my lungs at the point. And that's the reality about the disease. So the most important thing is prevent. Put on your mask, social distance, avoid gatherings. Just try as much as possible not to get this disease. That's the only prevention, Sam.
All right, and I hope the viewers are hearing you. But Senator Moses Kajwang, good morning, and thank you for joining this conversation. And you're talking about the cost of COVID-19. So you hear Dr. Chibanzi there saying the reality that if you get the severe disease, then chance of survival is very slim. But then again, the cost of getting this treatment is not within reach for many Kenyans. Just last week, we had the NHIF as well as the Cabinet Secretary saying that you're really on your own. I mean, what can you do because of all this difficulty that people are going through because of the economic impact of the pandemic, and then you're told that really there's nobody to pay for it?
Good morning, Sam. It's an unfortunate situation. A friend of mine lost a brother last week. He told me the brother was in ICU for 14 days, and they've been slapped with a 3 million bill. And this is a family that is incapable of paying that bill. And so people are making choices that they ought not to have made. They're making choices between treating COVID and putting food on the table, treating COVID and making sure that families are stable. It is a pathetic situation. I agree with Daktari that our focus must be preventive rather than curative, because once the virus hits many of us, it will take a toll, even if you have the money to take care of yourself in hospital, but it takes a toll on your body. The focus now, we must go back to public health systems and institutions to ensure that we take a preventive approach, we take a proactive approach to ensure that our people are not exposed to situations that will put them in direct line with the virus. We have seen, and I am in the village as I speak to you, I'm in Homa Bay County. I have seen that after the first wave, a lot of people let their guard down. When you go to funerals, you are seeing a situation where people are going back to funerals the way funerals were before COVID. When you look at public transport systems, you are seeing that people have thrown caution to the wind. I was in an event yesterday, and I was probably the only person who was putting on a mask, and I was looking like an oddity, because everyone else was thinking that this is a disease for Nairobi people. Now that this disease is in communities and local communities, I think we have a very, very, very scary perspective. Insurance companies, and I think Kenyan insurance companies, are some of the most conservative and risk-averse institutions. It was the Commissioner of Insurance who first came out saying that insurance companies were not going to cover COVID. Now, if insurance companies have covered things like earthquake, they've covered things like terrorism, they've covered things like political risks, why should they not design a cover for COVID? Because we have seen that it does not kill everyone that gets the disease. And I think that maybe for we as legislators, we must call the Commissioner of Insurance and put pressure on him to ensure that the insurance industry, the local insurance industry, comes up with innovative products that can push on Kenyans. Unfortunately, the Commissioner of Insurance presides over a very, very small section of Kenyans. And we now must find a way to ensure that NHIF can cover COVID-related risks. Then the final thing is just also to reflect on the healthcare situation in the nation. Why did we establish county governments? We established them to ensure that things like health services would be delivered at the lowest level possible. It is called the principle of subsidiarity. And yet when the virus broke out, we realized that many of our counties did not even have ICU beds. But 6 months or 7 months down the line, many of our counties have told us they've put up 10, 20, 30 ICU beds and isolation units. It is time to reflect and to make sure that public hospitals are also able and capable to offer proper health service as a public good, so that those who are out of reach of NHIF, out of reach of private and formal insurance schemes, can also find some relief. But ultimately, sir, this is unprecedented. We must take a preventive rather than a curative approach to COVID.
Right, and Senator Kasanga, so when the COVID-19 pandemic hit the country, of course you remember the various images of very distraught Kenyans who are returning from outside the country, and they were told that they were going to quarantine at own cost. Then that changed, and actually the Minister of Health, that is Mutahi Kagwe, apologized and said that from then on, people are going to get into quarantine and the government was going to pay for it. But then we reached a point that all that treatment and free testing is changing, to the extent that just recently we saw a family say that they have spent more than 700,000 to go through treatment for COVID for the 3 of its members. So what are we staring at in the coming days, and is there anything else that can be done to change the model or the model of meeting the cost of treatment, even as you hear the proposals from Senator Kajwang?
We might find ourselves in a very difficult situation, Sam, as we move forward. And as long as the numbers are rising as fast as they are, which is something that we were also scared that we should get to this position, then we have a serious challenge at our hands. Without a doubt, you've heard it from the CS himself that NHIF is undergoing reforms. And these reforms actually is from a report that I am aware of, I'm privy to, because I was in the health committee as a friend when we raised a statement on NHIF and their capacity. And the issue of this reforms came up, And there was a report, I think it was shared with the Committee of Health, on the kind of reforms that were envisioned. And even at that time, when we met with NHIF, it was clear that they did not have the capacity to help Kenyans when it came to this pandemic. Already they had challenges with their collections. Already the amount that is collected per person is very little, and they were proposing that they needed to increase the amount of money that is remitted by employers and people. And if they were to support the universal healthcare rollout that was going on, then a lot more money was required. And there were several other dynamics around it that required these reforms that the CS is talking about. Now, we are talking about doing reforms at a time when we're already in need of this NHIF. So already you can see then there's a problem. So when will the reforms be done? When will the money then be enough to help Kenyans? And this is why we are telling Kenyans, and I've said it here many times, personal responsibility. That preventive approach is the only thing right now that we have, and I don't wish to cause alarm, but it is what it is, because NHIF has already come out clear that they cannot handle COVID-related expenses for Kenyans as a whole. So then we are left now to our own devices, which means we have to make sure we don't get this disease, and we have to do everything as much as possible. Now, I appreciate that the Ministry of Health that has shared, I think, widely enough on protocols for home care and protocols for prevention, and what we need to do, including sitting out in the sun for 15 to 20 minutes to get your vitamin D. There are all these proposals that have been given by the Ministry of Health and by our various doctors who are on the ground that then Kenyans need to adopt for preventative measures. Let us not expect that you'll get this and that you'll get COVID and that your cost is going to be covered by the government. That expectation needs to be dropped, and to be dropped significantly. And then again, our county hospitals, as you have heard from Dr. Chibanzi, you've had the lack of preparedness at the county level. You've even heard it from Senator Kajwang there. These are the things that we've been talking about, the lack of preparedness, the lack of accountability. Kenyans need to know that they must take personal responsibility when it comes to COVID. Try as much as possible not to get it, and try to understand the disease such that should you start feeling something, at this time, you should really analyze and know your body enough to know when you start getting that dry cough that comes at the back of the throat, or when you start getting certain symptoms, then you need to know what you must do in the first onset to help prevent the disease from progressing into the lungs. And these are the conversations that we must continue encouraging Kenyans to have, as much as your social distancing, staying away from crowds, doing only what is necessary if you must go into a social space. And these are the advices that I'm giving a lot of my colleagues, because now as we speak, I think every other Kenyan is going to begin to say, I know somebody who has had COVID. Myself, I can tell you I have a list of probably 10 people I know personally who are sick, some severely, some are still in hospital, some have been able to handle the disease by being at home. And even at being at home, once you get the disease, it is still a lot of work even at home. And you want to try and do as much as possible at home before you go to hospital, because you're not even sure if you get even space in the hospitals as we speak. So as this is progressing, our expectations really need to be as far as what you yourself can achieve personally, which is preventative.
Right. Very well spoken. But also you have to remember that Dr. Chibanzi Mwachonda just has told us that once you get the virus, you have so little control. Actually, he said no control on what it does to your system. But now rejoining the conversation is Dr. Mohamed Kuti, the governor of Isiolo County. And sorry about that. So many has gone on in the conversation. At the moment, Governor, we are talking about the cost of treatment. And we are looking at how it began with people being subjected to their own costs for quarantining, to the extent then we were told that the government was going to pay for certain fees, including for treatment and testing at public facilities. Now we are at that point where every person has to take care of themselves. What are the modules that you're using in Isiolo County, and what is the focus of the Council of Governors in dealing with this pandemic at a time that is becoming pretty expensive for families?
Thank you very much. I'm really sorry I lost I got lost in the conversation because people kept calling and I was using a phone. I'm not near my laptop right now.
That's okay.
I must say that we're dealing with a viral infection that is very aggressive and very highly infectious. I think we need to realize that this disease is really fast-moving, and we really tried the first round, and it's mainly the Ministry of Health directives, if followed, could really minimize the spread of the disease, and that is face masks, washing hands, social distance, so that we try to minimize the contact. Therefore, because every contact with an infected person means transmission. And initially, when we stopped the flight, made lockdown and reduced movement, closed churches and bars and everything, closed the schools, then we were able to have very close to, actually we flattened the curve because we were less than 5% infection rate. So when we opened up, because the impact of that closure had also a very significant impact on the economy, and people are losing jobs, and you know, people are suffering on the economic side. So when we opened up, then therefore it meant more contact. People were moving, and especially to the rural setup. There's more interaction. Bars were opened and schools partly were opened. And therefore, this meant then there's more contact. And this is a disease just about contact.
Right.
If someone is infected and there's more contact, then more infection, and that fast it moves. So this is now where we are. And it's out of the balance that we decided to have between the disease situation and the economy.
Right.
I think in terms of preparedness, the government tried both national and county at the county level. These isolation centers were set up, ICUs that never were there. There was a lot of improvement in the health sector because of that preparedness. People had to move faster to try to see what they can do. But obviously, this is a disease that is overwhelming even the best of economies, even the best of health systems. And definitely, if we do not focus on the preventive aspect, which is to minimize contact, then however prepared we are, we can never be prepared enough, based on even the experience we are seeing in America, in Italy, in France, in the best of countries that have the best health systems. Therefore, the main thing is that we focus on prevention, that we push for this face mask, hand washing, social distancing. Because if we don't do that, and if we just think that the government can manage, I don't think this is a combined effort, but more so, it's an individual effort. I think once we realize that each individual is supposed to follow Ministry of Health guidelines,
right.
If we just do that, then we will really reduce the spread, and then we will not overwhelm hospitals, and we will not overwhelm our health workers, who actually now are getting the brunt of, and we are losing quite a number of them, and quite a number of them are falling because of themselves getting infected by our people.
Yes, and Dr. Kuti, the unfortunate reality is that at the moment it appears that the health system is getting overrun. But let's listen to what the healthcare workers have been saying, including the doctors and the clinical officers already threatening to down their tools because of how they feel neglected in as far as their welfare is concerned.
So if you threaten us in any way, I go to work, I will die. That is the line. We have drawn the line. It's our lives. And those lives matter. Doctors' lives matter in this country.
You're burdening the healthcare workers. And when they fall sick, they're on their own. It cannot continue like that. It can never be business as usual.
If within the period of the next week, the government is going to do anything, then we'll have no option but to also consider our lives first and withdraw our services, because the environment is already hazardous for us.
Right. So this, that's Dr. Chibanzi Mwachonda, then the representative also of the Kenya Union of Clinical Officers. And Dr. Chibanzi, we have had this conversation for a very long time. Please allow me to make you repeat it, because when it began, we were told that there's some money that was being set aside between the Public Service Commission and the Health Ministry. They were supposed to sit down and come up with a welfare package that was going to be benefiting yourselves, the doctors and the other healthcare workers. Now we are at this point that you've been fighting for your rights. What is the reality on the ground as we speak, in as far as how your welfare is being taken care of, but also having to treat those that catch the virus in line of duty?
Thank you, Sam, for that question. And I'm glad the governor is here. He's my senior in the profession. But I'd also like the governor to tell us the incident of the nurse who died from Isiolo County because there was no ICU and the nurse was being transferred from Isiolo all the way to Kenyatta University and Referral Hospital just to get ICU. And I remember getting calls on that day just to try and see how we could help out. So that is my answer in the beginning. It's a reality that we are facing. And some, I've been saying this since yesterday, that the governors, the CS and the PS health have failed us as healthcare workers. It is the reality that we must deal with. We cannot, as healthcare workers, raise issues for 8 months. And I'm really glad and appreciate the efforts of Senator Sylvia Kasanga here, who worked with us, went to the ground, assessed, and even gave recommendations in the Senate on what was required for the healthcare workers. We gave a memorandum on the recommendations to sort the issues of healthcare workers to the 5th Extraordinary Summit. And everything is clear that we've put forth there over the last 8 months. So it's 8 months down the line. They have not been implemented. There is no compensation package at peak because there are interests that have come in. And at some point I got called and I was being told that, you know, if healthcare workers continue to die, everyone who is support, the insurance companies that also come and support this compensation will pull out because then they're looking at the business interest and how they're going to lose out. So that's the reality that we are facing in this country. And that's why I was saying this yesterday and I'll say it again. We have drawn the line. If nothing is done in the time that we have given, forget it. You will not have healthcare workers in the facility.
And Dr. Kuti, so hearing from the representatives of the doctors in this country, of course, who are very critical in caring for not just patients who contract the COVID-19 virus, but also those other patients with different ailments. What do you think in the short term you must do to secure the presence of healthcare services in these hospitals?
Well, I think I want to appreciate the role played by healthcare workers, and I want to appreciate the sacrifice that they give, not just now during COVID, but has always been, in sometimes even in very difficult circumstances, and I really want to appreciate that to begin with. Having said that, I think we must appreciate that we are in a pandemic that has overtaken the whole world, not just Kenya. A pandemic that, you know, even the best, as I just said earlier, even the best of facilities have been overrun. And I think it is a war situation we are in. And in war, I think what prevails most is patriotism. Obviously, when I say patriotism, it does not mean just on the part of health workers.
Right.
It is patriotism from everybody. The managers of health, the government, be it county or national government, and every citizen. Even in terms of the prevention, that's part of patriotism. So I think we are in a war situation, and I think it is very, very important to know that this is an abnormal situation that has not happened in the last 100 years. And in such circumstances, we should not treat it like as if some blame games will not help us, because this will overrun any institution, any government. And we will have to do our best. And I know that some packages were planned earlier, some were given. I think a discussion needs to be done a meeting has to happen to see what should be done in order to alleviate as much as is economically possible, to see that the health workers' welfare are looked at, especially those who have passed away in terms of compensation, those who are working in terms of their protection through proper PPEs, and in terms of compensation for the service. But let me say that not any compensation or not any arrangement that we can take can be able to stand in the face of this pandemic. It is just patriotism. But having said that, I think maybe we tone down and we get sober a little bit on this situation. We have a meeting. We had a meeting earlier, and in that meeting, I think something came out and some payments were done to compensate. But at that time, we didn't know how long the pandemic was going to last. So I think it was about 3 months, or I don't know, 6 months. I'm not sure exactly. It was managed by the Human Resource Department Committee of the COG, headed by Ongwai. And I know some package were passed on and were actually paid. Those packages, I think, may have now expired because nobody knew how long this pandemic was going to last. I think that discussion could be started again.
Okay.
And so therefore, but I'm saying that we are in a situation where we will be overrun, just like other countries, if we start blaming each other. But I think let's start talking to each other. Let us start finding a way to save our people.
Right. Senators Kajwang and Kasanga.
I really want to say something.
Sorry, Governor.
The nurse who died, I think I wanted to
I really want to say something.
Well, okay, Senator Kasanga, let's allow Governor Kuti to finish his point.
The issue of this, the nurse who died, it's very unfortunate. It's a nurse whom I know, and the ICU was there. But, there was the whole issue of trust, because the hospital has been seriously politicized. And when the senator for the area stands up to say this hospital should be closed, the public confidence has gone down, and we feel we should not politicize this pandemic.
Okay.
And the moment we politicize this pandemic, we'll lose it. So I think it's a matter of checking the facts. This is an emergency. We have an ICU. Right now it is based in a classroom, that's KMTC classroom. We are now this week moving it from the classroom to where it's supposed to be, because it doesn't take a day to build the facility. It was not there before. But the beds are there, and the ventilators are there.
Okay.
Oxygen plant is there. We have put up an oxygen plant and piped it to every bed. But the classroom does not have the connection of oxygen. We take there using gas cylinders. So now we are moving to a place where we've built and piped oxygen is there. So I think this is something that is emergency.
Okay.
This is something that we need to improve day by day.
Right.
But instead of blame game, I think it is time that our patriotism takes charge of ourselves.
All right, Governor. Senators Kajwang and Kasanga, allow me just to get a clarification, a brief one from Dr. Chemazi Mwachonda, because the governor there speaks to patriotism, but also says there had been a package that had been agreed upon through the HR and Welfare Committee chaired by Governor Ongwae. How much of that statement is not true? And if that is existent, why is it so bad that you've not been able to agree on the way forward and avoid this antagonism that is obviously hurting service delivery?
I've listened to the governor speak, and he's talking about patriotism, and he's talking about us not doing blame games. But the same people who don't want to sit down with unions and discuss these matters. Some have said this. I raised the issue with the ministry and the Council of Governors in June, when the number of healthcare workers who were infected was only 84. And I indicated in my letter that we are asking for a meeting to deliberate on the welfare, occupational safety, and health of healthcare workers in the COVID-19 pandemic. You're taking around in circles for 5 months, and you're talking about patriotism here. Who should be patriotic? Us or them? We took an oath, they took an oath, swore by the Bible or the Quran that they will protect the constitution of this country, they will serve the public in this country. So I'm not blaming anyone. I am putting it as it is. You cannot abdicate your responsibility of taking care of healthcare workers and then come here and tell us that we be patriotic. That one will not accept, Sam.
Okay. Senator Kasanga, then Kajwang.
Thank you so much, Sam. Listening to the governor, the kind of answers that you receive when the governor speaks is something that leaves your heart aching. Sam, I have reported so many times on this forum since our committee started in March. We have had conversations. There has been time for preparation. Money was sent down to the counties by the middle of the year. So from July, August, September, what is it that the county governments have not really put their foot forward when it comes to healthcare workers? We have been talking about packages for healthcare workers. We even had this conversation with the Ministry of Health, and we tasked the county governments as well to put forward their own packages and motivation for healthcare workers. We are still yet to get any response for that. Now, Governor Kuti is a very senior citizen in this country. He is a governor. He's in charge of a budget of almost 8 to 9 billion, and he sits as a chair of the COVID-19 committee at the National Response Team. I have said it again here. There has been challenges when it comes to oversighting and accountability. When the senator of Isiolo raises a question on accountability, it is called politicizing. Surely, you expect the senator to be politicizing an issue like this one. It means her citizens have called her and they have said we have an issue here. Actually, Isiolo County was on our radar. It is one of the counties we visited, and we did have an issue that we were not happy with how the ICU was set up. We saw beds, but we were not sure whether the beds are working or not. If at all the ICU is working, then why should a frontline health worker not be able to be treated in that ICU facility? Why did she have to be airlifted or brought to another facility? You see, these are the issues of accountability that we are having a challenge with. The governor should tell us from where he sits, from the senior position where he sits at the National Response Team. Why is it that the Ministry of Health report has rated county preparedness at only 15 to 20%? As county or COG, what have they done about it? What can they tell Kenyans? Why is that level of preparedness in that manner? It shows you that the money that was sent down to the counties, the 5 billion, was not utilized accordingly. As well, the supplementary budgets that were presented by the county assemblies were not utilized well because we don't have accountability for it. And that's why we called the Auditor General to do this audit for us. Also, let us also remember the County Assemblies Forum did express their frustration that the governors have failed to give them an opportunity to account for these funds. And the County Assembly Forum did say, Sam, and it's unfortunate we have to prosecute these things in public, but let us say it so that we don't say senators are politicizing. Governors need to tell us, why is it that the impact on health facilities is not being felt significantly after 5 billion was sent down to the counties from mid of this year up to now? Why? And yet the funds were there. The County Assemblies Forum has a report tabled with us, and that is what it is said. And then lastly, Sam, just so that I can express to you some of the frustrations we have from our legislative and oversight facility. In our exit report, we have written that one of the challenges that we have is when you summon officers to answer, they don't show up. We summon governors to come and account, they don't show up. You send summons, you do everything, they don't show up. At a time like this, when we are dealing with COVID, when the ad hoc committee on COVID summons a governor, why should he not show up? Where is the patriotism we are talking about, since he raised the issue of patriotism? Okay. Who should be the first person to show patriotism? You cannot expect doctors to show patriotism when their own lives are at stake, and yet our governors are sitting pretty and comfortable. And they are the ones who should be accounting for these funds. It is really frustrating, Sam, and I didn't really even mean to get frustrated, but this is how the things are right now.
No, it's okay. I think we can only make progress if we are true with ourselves and we express the truth. But Governor, I'll give you an opportunity to have the right of reply. But Senator Kajwang,
thank you very much. I think
just a moment, Governor.
I am surprised that the way people are taking this discussion and of blame game
Right.
In a pandemic will, if we talk about blame, let us ask ourselves, counties have not received money for 4 to 5 months
Governor,
because some formula could not be passed at that Senate.
Governor, Governor, may I disrupt you?
Can you hear me?
Governor, let me do so that I allow Senator Kajwang to make his comments, then you can respond to both, if you don't mind. Senator Kajwang, what are your thoughts in the experiences of the healthcare workers and also the reality on the ground with the counties? And I believe you're still in Homa Bay. What are the specific lessons that you've learned in that county?
Some we can blame each other till the cows come home. But at this particular moment, what Kenyans need is us.
I've listened to the governor and honestly, I don't know what to use. I respect him very much, but time to be honest and truthful. I am not my mental state is very much okay, and I'm not stupid not to know that this is a pandemic. I know very much that this is a pandemic, and that is why we took all initiative and asked for them to write to them, give them memorandum recommendations for them to consider. But we've gotten to a situation where now we have to threaten a strike for them to now start saying, let us sit again and reason. That is the reality. So what it will take, there are 20 days. These 20 days, we are available, we will discuss. But if they go down with this route of patriotism, going to court, intimidation, and threatening us as healthcare workers, I can assure you, Sam, no doctor in this country now wants to die because you're being told you're supposed to be patriotic. That will not happen. It is our lives.
Okay. Dr. Chibanzi Mwachonda, thank you so much for that. I wish you had more time, Senator Kajwang, Senator Kasanga. I still feel that Senator Kajwang has not had enough to say. But Governor Kuti, also thank you so much for joining the conversation. It may never end, but we hope that there will be a lasting solution.
Sam, you have to give us a parting shot.
Or a sustainable solution. I wish I could. We are practically out of time.
Just one parting shot. Just one.
Okay, 10 seconds then.
Thank you, Sam. I just want to say that Kenyans need to really take precaution. And also, we have seen the U.S. government right now fall because of the way they handle the pandemic largely. So let leaders know, let governors know that we are also watching and monitoring. And when we ask these questions, we are doing our legislative duty. It's not a question of pointing fingers. We need accountability. And in fact, just so that Kenyans can know, as part of our exit report, we will mention the governors who failed to appear. Governor Kuti is one of those who also failed to appear. So then we can say to Kenyans, we are trying to do our work, but we have so many challenges, and let us all be patriotic on the same front, in honesty and equality. Yeah.
Honesty and equality, you say. Alfred Obengo, who is the president of the Kenya National Union of Nurses, says that verbal appreciation of healthcare workers is stale. You'll soon have no one to attend to Kenyans at the health facilities if the Ministry of Health doesn't change its approach from public relations to action. He's the president of the nurses. And then what is the need of financing insurance companies if they can't deliver during the time of need? This is clear communication to Kenyans. Insurance companies are just making money, money-making organizations. That is according to Engineer Lazaro Kanyambok. Thank you so much for your feedback. We may not have enough time to continue this conversation, but it continues so that we know where the country heads. After the break, Sporty Monday is here with the Willis Raburu and his gang. After the break again.